Dengue is the most important vector-borne viral disease of man, and is becoming an increasing problem due to a variety of factors, with the emergence of hemorrhagic fever in this hemisphere and the presence of all 4 dengue serotypes. We face a very dangerous situation in the Western Hemisphere with regard to dengue. Increasingly, it has become the focus of research in our laboratory. We have a branch of our division in San Juan, Puerto Rico, under the leadership of Dwayne Gubler, working exclusively on dengue prevention and control. And in Fort Collins, we have increasingly refocused from the encephalitides onto dengue as a principal area for research. So it is clearly an important problem, and that's been reflected in our program. I think dengue is a good example of how you take a multidisciplinary group and focus a number of people and different disciplines on a single problem. One of the things that we have done is to, in our molecular virology group in Fort Collins, is to focus our attention on genome variation of dengue viruses, and to use that as a tool in epidemiology to predict and understand the spread of dengue viruses and the potential for epidemics.
Tom, in continuing our discussion about dengue, I know that one of the things that you and your group are currently involved in the United States has to do with the finding of Aedes albopictus in various parts of the United States, and the method of entry through tires being brought from abroad. Do you want to talk a little bit about your experience with used tire importation in the United States?
I never thought when I was in medical school that I would be worrying about the used tire trade and movement of tires around the United States, but in fact, for the last 2 years, I have personally had to devote a lot of my time, and others in my division, in particular the entomologists in our group, have had to spend nearly 100% of their time on this problem, which began in '85 when albopictus was discovered in Houston, Texas, and it's now spread to 17 states and has appeared in Brazil. And it's been a little bit, despite the fact that it's taken up so much of our time and our resources in our division, since it's not been demonstrated as a disease vector as yet in the New World, it's been a problem, a battle for us to get adequate support to deal with this problem. And I think at this point we're really at the point where CDC is conducting research, but there's no effective prevention or control strategy that's being implemented in the States or in Brazil. The one success story was the development of a strategy for preventing further importations by actually using legislative means to require that tires coming in from Asia be treated to kill mosquitoes, and that this certificate accompany all imports. So that's one successful piece of the story. We've had, to accomplish that, we've had to have meetings with the tire industry. I personally, instead of attending virology meetings, I've attended meetings of the National Tire Dealers and Retreaders Association on a number of occasions, and it's been an interesting diversion from virology, but an important one. I think, to be serious for a moment, the introduction of this vector takes us an additional step towards creating a situation in the New World that exists in Asia, where, of course, dengue hemorrhagic fever has been a major public health importance. So now we have all 4 serotypes of dengue. We have both the classical urban vector, Aedes aegypti, and now the rural vector, if you will, sylvatic vector, Aedes albopictus present potentially. And I think we're even further down the line to having some very serious problems in the future with dengue in this hemisphere.
I know you've had a study of arboviruses in Argentina now over a number of years and have published a number of important papers regarding the arboviruses in Argentina. You want to elaborate on that
Well, I think
study?
you raise a very important general concept, and that is that virus ecology can really not be addressed without a commitment to a longitudinal, long-term approach. There are, just to mention one, there are obvious seasonal factors that come into play and that influence virus transmission in nature. There are year-to-year differences that depend on density of hosts and vectors involved in the cycle and so on. So you can't step in and do a point prevalence sort of study and thereby try gain an understanding of the ecology and epidemiology of these complex diseases, whether we're talking about Lassa fever in Sierra Leone or an arbovirus infection in the neotropics. So we've always recognized this. We're not the first ones. There have been many previous long-range studies of arboviruses conducted at CDC and elsewhere. But our group has certainly been engaged in a number of those. I'd like to mention 3. One was studies that we did in our back door in Colorado on Colorado tick fever, which went over a period of about 5 years. And we're focused on the Rocky Mountain National Park. Not a bad place to conduct research. But
in fact, if I may interrupt for a second, it was when you guys were doing that I first learned how to bleed amastomes. I spent a week with Bob McLean out in that very study, learning how to eye bleed rodents. So,
well, the influence is even deeper than I thought. But those were important, very important studies, and they again they took into account human disease incidence. We were able to show that the risk of acquiring Colorado tick fever was very high, about 1 in every 250 camper days. We defined the various cyclic changes in tick populations, the rate at which small mammals were becoming infected, and really defined the whole ecology. In fact, probably the most important paper that came out of that, there were many, was published in Ecology rather than in a virus journal, and that's a very prestigious journal that requires, which publishes work of high quality in ecology. It's not often that you can study an infectious disease with quite that level of statistical validity and in-depth analysis. So there was that 5-year study, and then about the same time we also were engaged in long-range studies in Ecuador on arboviruses that grew out of the 1969 epidemic of Venezuelan encephalitis, still one of the largest ever recorded. And in collaboration with Ernesto Gutierrez at the National Institute of Hygiene in Guayaquil, we were engaged in, again, for about 5 years in studies on arbovirus ecology in Ecuador, the principal goal or objective being to define what happens to Venezuelan encephalitis virus in between these major epizootics. That study has resulted in probably 15 or 20 published papers on a wide variety of subjects. As those studies in Ecuador wound down, we began a series of similar studies in Argentina in collaboration with Dr. Marta Sabatini at the University of Cordoba, who had a long-standing interest in arboviruses, but had focused most of her research on Argentine hemorrhagic fever. And but there was this problem in Argentina, which was quite similar to the United States, of recurring epizootics involving horses and occasionally humans. And we thought that by understanding better the ecology of the encephalitis viruses in a temperate country at the other pole, that we might gain some insights into the situation in North America. And it was also important to determine the etiology and the vectors of encephalitis viruses in Argentina, which, despite the fact that there have been major epidemics, there was no basis of information on these questions. So we conducted studies from about 1977 to 82 and resulted in some important new information about the encephalitis viruses and their epidemiology in Argentina.